Hello class, my name is Jorge Soto, and in this presentation I'm covering Module 6, which refers to social justice. In this case, I decided to highlight how my project covers the basics of social justice. In this case, I titled it Social Justice Aspects of the Healthcare Grievance Process. As background, we mentioned here that the Centers for Medicare and Medicaid are the safety net that was created by the progressive or liberal policies of the 1960s. And in turn, these basically shape and influence the framework on all the healthcare delivery systems, including the private ones. As part of this whole thing, CMS asked for a robust grievance process. So this process here basically is meant to safeguard fairness in the system. In this one here, you can consider this covers procedural justice. It also addresses the problems or any issues or complaints when it comes to the care received are remedied, and this covers compensatory justice. Grievances that have a quality care component are named potential quality issues, which is basically any issue that can affect the care of the uh, recipient or patient. And it mentions here that the goal being that patients have access to quality care in a timely manner. Providing quality care is considered a non-zero sum game, basically a win-win scenario where everybody benefits. And this portion covers distributed justice as the resources, especially in the safety net like Medicare or Medicaid, are limited. So achieving quality care can ultimately help by utilizing or maximizing resources as much as we can. Here, this image just highlights the three social justice principles we covered, which is procedural justice, compensatory justice, and distributive justice. Now going back to my project, the project selected for this course involved the revamping of the previous grievance reports. And this can be done quarterly or yearly. In this case, we're focusing on a yearly report for 2019 for all the grievances done, especially the ones that have a quality of care component. This was done and facilitated by a new digital platform implemented that can provide us new spreadsheets and tables, which in turn were imported to SQL to be able to run queries. So the new queries are meant to provide new analysis, and summarized here mentions that this constitutes the type of information needed for enhanced quality improvement interventions and for the development of policies that could ultimately prevent both grievances and PQIs. Prevention being the goal, as it again benefits the patient and has the added benefit of reducing costs. For my artifacts here, the first one covers a query that's basically reimagining or redoing the top 5 grievances by category and divided them by quarter, so we can see any trends that might be useful. With the new information by the queries, we were able to do new tables and new graphs. This is with the aim of being able to capture people's attention better, especially in the meetings where decision makers are present. Now, this query is doing something new that was not in the report before, which is the cases or grievances divided by the type of intervention needed to resolve it, or the resolution type. Basically, what is it that the grievance analysis did to resolve the issue. And again, the information given by the new query provides new tables and this new graph. Again, it's a grievance resolution by quarter. And you can see here the types or the resolution categories. The most common one being here is provider change. The most common way of resolving a patient grievance here is changing to a different provider, be it primary care or specialist. And the other most common one was care coordination, basically helping the member resolve, or the patient to resolve, the issues they have with the provider so they can go back and continue their care with them. The other ones involve issues like transportation, or in this case, prior authorizations. These are, for example, authorizations for medicine or for any special service or device or medical equipment. And another one there's also common is patient education, basically when the members do not understand the benefit or how to obtain coverage properly so they obtain the services they are seeking. Following here, we have our references, and these cover different agencies from that are related to CMS, such as the California Department of Healthcare Services, the Agency for Research and Quality, which is part of CMS, CMS themselves and their grievance process, as mentioned by them, our new system, Innover, which is a digital platform for grievances and appeals and quality issues, our textbook for the class, which is mentioned leadership, another text regarding grievances and potential quality issues. Lastly, in the appendix section, we have the leadership evaluation by my two team members. The first one here done by a quality nurse. See here are the results. And my main takeaway from his comments was on how to be less abrasive when dealing with team members so they're more accepting of resolutions when managing conflict. The next eval here for leadership was from our quality auditor. You can see here the results. And from his feedback, my main takeaway was consistency in the workflow, especially when using consultants so everything flows properly. So that is all for my presentation of Module 6, Social Justice. Thank you so much, and welcome to feedback.